So the next topic we discussed here is Rickettsia, Rickettsial, Rickettsial. So Rickettsial and its related vector-borne diseases I will describe in this lecture. So Rickettsial is a vector-borne disease, and how it affects the human body. Well, it is spread by a tick known as derma center or American dog tick, and when some hiking traveler travel to the North Carolina, South Atlantic mountains, and they over there the tick bite them, then they cause the tick cause rickettsial, and it is obligate intracellular pathogen, and that's why it evade phagolysosome and causing a classical triad causing fever, headache, and rash. So how this rash happen? This bacteria attack vascular endothelium, damages the vascular endothelium, and causes rashes. And whenever the endothelium is damaged, platelets come and consume over there, and leading to a complication of thrombocytopenia. So in the scenario, we have non-specific symptom, fever, headache, and then there is a discussion of a trip to mountain area, and over there they came across on the labs of thrombocytopenia, and now the specific finding is vasculitis, which appears as a rash. So R for rickettsia, R for rash, and there is a R for wrist or ankle. So the rash starts from the wrist and ankle and spread to the palms and sole and trunk. So this clinical course of rickettsia is very much important clue to differentiate different species of rickettsia. So only Rickettsia species causes involves the palm and sole, but the rest of the Typhi and Pravazikii is not including palm and sole. This pair palm and sole. So this is regarding the discussion of Rickettsia species. Now Rickettsia Typhi and Rickettsial Pravazikii, they always spare palms and sole. So if in the scenario we have a clue of sparing of the palm and sole, then it is Typhi and Pravazikii, and if the vector is flea and it is endemic to that area, then it is Typhi. But if the vector is human louse or pediculosis, then it can cause, and there is an epidemia, then it can cause Pavzikai. So this is how to differentiate three major important types of Rickettsial. So Rickettsia, in the Rickettsia section we have and Rickettsia related problems. We have the Rickettsia, and in this we have rash common, and the treatment of choice is always doxycycline because it is spread via tick. So doxycycline inhibit the bacterial protein synthesis, leading to the treatment of rickettsia. Then rash. Now there is a non-rash conditions known as Ehrlichii, causing Ehrlichiosis, and in Ehrlichii there is a lone star amblyoma, lone star vector, which causes Ehrlichii, no rash, Ehrlichii. Then the person is it is also obligate intracellular, and Ehrlichii evade phagolysosome and proliferate in the monocytes as a Melbury monocyte with the merula as a Melbury-like inclusions in the cytoplasm. And also it bacteria harbor in white tail tears, causing lymphopenia. The next one is Anaplasma species. Anaplasma is spread via again tick vector, and also differentiating feature is the Anaplasma replicates in the granulocyte with merula. So these 5 species are important regarding how Rickettsial. They are very much not very much tested, but they can be tested in the final boards. So after Anaplasma and Rickettsial, we have the last one, Coxiella burnetii. And this Coxiella burnetii, there's a story behind this. In the scenario, there is a boy who has spent his vacation trip to a farm or to his countryside grandparents. Over there he is dealing with he is doing some house chores, and in the house chore there is a farm animal chores, especially the waste and hide handling. So that person is helping his grandparents, especially in the farm chores. And in the farm chores there is a farm animal waste handling and hide handling. So this Coxiella burnetii can spread via spores through inhalation. It is closely related to Rickettsia family, but it does not use vector or rash, does not causes rash. Rather, it uses spore or aerosol mode of transmission. So it goes into the respiratory tract. It is obligate intracellular, evading the phagolysosome and causes lysis, and now spreading 10-day fever. So the person is having a fever after returning from his vacation on the farm. He take that bacteria through aerosol transmission from that farm chores. And so 10-day fever in which the bacteria uh, bacteria causes fever, and there is a replication proliferation in the into the macrophages, and then there is a severe retroorbital headache and also influenza like symptoms, and after few days the person is having lobar pneumonia or consolidation with coughing. So coccidiosis, it can also, the symptoms also combined with hepatitis. So there is a elevated ALTs and ASTs. So if you do not treat this bacteria, so the complication is very much fatal, causing endocarditis, especially culture negative Hasek organism. And in the C section, in the C, we have this Coxiella burnetii. So evade phagolysis also causes thrombocytopenia, and the treatment of choice is all obviously doxycycline. So this is how Coxiella burnetii spread its modes of and causes different symptoms. And so this is all, this segment is all about the Rickettsia family, how Rickettsial can causes different diseases and different its different species and different vectors. So there is a lot of stuff over here, and in this stuff there is a lot of questionable material. So these are not high yield, but a middle high to middle yield data over here, especially for the assembly step 1.